So welcome to OpenGov TV. I have a fascinating set of panelists today, and we're going to cover an incredible topic. As you may know, everybody has had to jump on cloud. Cloud architecture has become the forefront of all conversations today, and COVID-19 has become the chief transformation officer in every organization, government or private. So what do we have? Okay, I have my panelists. Let me just introduce, please, first. Okay, I got Dr. Suhazima Binti Dazali, who is the Deputy Director, General Information and Communication Technology, and the Government Chief Information Officer from Mampu. I've got Dr. Ang Wan Peng, who is the Chief Operating Officer for MDEC. I got Dr. Fazila Alauddin, who is a Senior Deputy Director, Planning Division, Ministry of Health for Malaysia. And last but not least, I have Yeo Siang Tiong, who is the General Manager, Southeast Asia for Kaspersky. Yes, we will talk about cloud. We will talk about the usage of cloud, the architecture of cloud, and the security of cloud, which is a very, very important topic. Okay, in no particular order, Dr. Su, but may I start with you, ma'am? Just from a government perspective, in the pre-COVID era, if I may ask, where do you think the organizations or government agencies were on the journey towards cloud-based?
As far as the Malaysian public sector, we have been gearing towards what we call shared services way back since 2010. But at the time, the strategy was to establish shared services for data center and disaster recovery center. That actually has prepared us to elevate ourselves towards establishing government-private cloud. And in the last 5 years, basically since 2016, we have actually upgrading our data centers to be cloud-based environment. And I would say pre-COVID era, we have been providing infrastructure as a service, platform as a service, and to a certain extent, certain software as a service. But there's much more to be done as far as having a real good cloud, private cloud environment. So there's not much difference between pre and post, but we see that the post-COVID era has basically heightened the awareness about having infrastructure available to them. We see during the MCO, the Malaysian MCO is what?
MCO.
Movement Control Order.
Yes, the movement control order. Escape me. But okay, during the we see some agencies reaching out to us and say we want to do things remotely. Hence, they need the cloud cloud services. That actually is a positive thing as far as the awareness about what cloud can do for agencies.
Dr. Ang, if I may ask you from an MDEC perspective, do you think shifting to cloud has made operation and data management more effective?
Absolutely yes, the answer. We have been promoting the cloud first policy for a long time for the business side. Obviously, government side will refer to Dr. Su for her to pursue that. During the COVID lockdown, I would say the MCO period, the demand for cloud services has increased. It's not like 10%, 20%. It goes in multiplier effect, like multiple times. And a lot of people suddenly realize that to continue to operate, you really need to depend on digital platform. And cloud is the easiest for anybody to adopt, especially coupled with the software as a service. And obviously before that, the platform as a service. People may not notice that we have been using cloud on some of the software like Google without knowing it. But now, beyond that, people are realizing if I want to do digital marketing, I want to do remote working, cloud is a key enabler. Yes, it also helps because from a more digitalization point of view, in order to drive digital transformation, we have to use cloud as the platform for us to store our data. Because you asked about specifically on data. Standardizing data is possible when you have to for your most of your information, because it's no longer kept in silo in somebody's computer or in some of your remote location. Now everybody access to the same source, everybody upload to the same source, and viewing the same copy. Definitely, cloud play a very important role in our drive to transform the digitally and helping business to be more effective and efficient.
Thank you for that. Let me pivot to Dr. Fazila. Okay, how do you think cloud architecture, ma'am, in the healthcare space, okay, in the past few months has evolved?
Well, Mohit, I think all over the world, especially during this, since February last few months in the crisis era, we have seen both public sector, private sector in health services, be it in Malaysia or globally, they have just turned to cloud providers to help scale and also rapidly respond to the crisis. And many of them are also using the commercial cloud providers. And I've seen this has accelerated. In fact, even all the webinars we have heard from other countries, it's the same as here. And I think with cloud services, it allows, it's a very practical option to enable quickly, for example, virtual meetings, working remotely, and also deploying solutions rapidly. In fact, in one of our quarantine center, the quarantine and low risk center at MAIP Serdang, we deployed our own hospital information system within days, which is a cloud-based system. So that was just amazing how it could be done.
Mm.
But as you know, we have many legacy systems, being in Ministry of Health, and so I think moving forward, it will be in a hybrid architecture, both on-premise or hybrid cloud or fully cloud, and this is the opportunity in this post-pandemic era to actually leverage on cloud-based digital platforms. And this will further accelerate digital transformation, which is what we are hoping in health services. But whatever it is, the architectural design must have the principles of security, patient privacy, data integrity, and good governance. So that is our hope in moving forward.
Perfect, and thank you for that. So then my next question, Sian Tiong, is everybody seem to be going to the cloud, sir, right? How do we keep it all safe and protected?
So, first of all, when we say cloud, it's very generic, but generally we refer to both private cloud as well as public cloud. And certainly the cloud technology has come a long way in terms of the technology of the processes, but also the data security. But having said that, cloud is a shared kind of facilities. So the cloud providers do have the flexibility of moving the data around within their various data centers to serve the users better. So that brings to the question how you then secure your data. Data encryption is a must. To make sure that your data remains encrypted, and even if it should falls into the hands of the wrong person, it stays encrypted. And that is your number one defense against it. But of course, the other good practices is also important. For example, encrypting the channel into the access. Right? VPN is another one. But nothing beats that security awareness of the end user. The end user, even though they are not experts in cybersecurity, they need to have some basic IT awareness, cybersecurity awareness, so that they know what is the best, what not to do, more than what they need to do, what not to do from a cyber hygiene perspective. And the third and most important pillar, I would say, is having the control and the security in the hands of the relevant organizations themselves. So the on-prem, off-prem hybrid will be a continuous conversation, and it will continue. At the end of the day, you need to have the ability to manage the security. So that means some consistency inside the security policies across. It also means some standard policies like encryption. It also means some standard processes in ensuring that the people still stick to it, even though they are working from home, and even more so. So that central security management and operation in the form of a SOC, in the form of an expert center, is critical, and even more so in today's world.
No, thank you for that. And you're right. It is, they are pillars, and we got to make sure that we are really focusing on all of them. You can't just focus on a few and not everything.